The procedure is called a endovascular right middle cerebral artery thrombectomy, emergently quickly removing clot from an artery in the brain that's blocking blood flow to a large region of the brain. So this is a 71-year-old Filipino-American woman who was at the community center. She kind of slumped over in her chair, was unable to move her left side of her body, was unable to speak well with marked slurred speech. She also had facial droop on the left side with rightward gaze deviation. Both eyes were looking to the far right. This was a massive stroke in evolution. These are the kind of strokes that can be devastating, where you have a large infarct of the brain, a large dead brain tissue, whereby the patient is permanently neurologically devastated. She was quickly brought to the hospital. Dr. Kobayashi of the ED got stat head CT that showed no hemorrhage, followed by a stat head CT angiogram that clearly showed the problem, which was a blocked vessel in the right middle cerebral artery. Before the second study was done, I was notified, so I was actually in the CT scan room and actually read the images hot off the press before they were sent to PACS. It saves time that way. And immediately called my team, and we immediately took her to the cath lab for an endovascular angiogram to remove the clot from the artery. We actually enter the artery from the top of the leg and advance a small tube called a catheter through the leg, pelvis, belly, chest artery into the right neck. I injected some contrast and showed that there was still the blockage that we saw in the CAT scan, which is usually the case. Then I crawled into the brain and in one pass with the mechanical device removed the clot from the vessel, restoring normal flow to the region of the brain that was previously denied oxygen and glucose. The whole procedure took 40 minutes. This was the first type of procedure in the history of Guam. No one's ever done an acute stroke intervention. Now we're treating stroke like the cardiologist has been treating MIs, going in emergently in appropriate settings to remove clot, restore flow to the brain, just like the cardiologists have been doing in the heart by restoring flow in blocked coronary arteries. On post-op day 1, she had normal strength in the left arm and leg, which was paralyzed previously. She had a very, very mild residual facial droop that is completely resolved over the course of several days. And her speech, which was markedly affected, is now almost normal. Minimal slurring of speech. She's walking now. She's full use of her left arm. This would be a woman who would have lost her ability to independently live. If you're paralyzed in half your body, you can't walk, you can't bathe yourself, you're severely handicapped. She got emotional in the room on Friday morning, and realizing what she narrowly missed, which would have been a devastating stroke. When she came in with the stroke, her brain was she was fully aware of what was going on. So she felt very fortunate, but she got very emotional and started crying.